Hello, everyone. My name is Dr. Richard Horowitz, and I'm the co-host of the Dr. Talk Healing Lyme Summit 2.0. It is my great pleasure today to introduce to you Dr. Kent Holtorf. I met Kent just recently, and we've known each other before at the ILADS conference. Kent does peptide therapy, and today we're going to discuss the use of peptides, the power of peptide therapy in those with chronic fatiguing illnesses. So, Ken, thank you so much for joining us today.
Thank you so much for having me. It's just nice to be with the king.
Thank you, Ken. So Ken, tell the audience a little bit about yourself in medicine. Like, how did you get into peptides? How did this all come about?
Yeah, and like I think a lot of people in integrative and especially the kind of Lyme area is that, I was very evidence-based. I'm still very evidence-based, but it's ingrained in medical school. Do not go to anything alternative, integrative, because it means no evidence. And I got very sick going through medical school, and a lot of growing up, weird things were going on. So I basically Lyme since birth, and and then but going through medical school and residency just started getting terrible. It's that can't even just so overwhelming to see a patient. And I'm like, something's wrong. So you go to the university doctors, like, oh, you're stressed, you're depressed. I'm like, no, there's something wrong. And so I thought I would have to drop out of medicine, but then I went into anesthesia because they're asleep. You don't have to speak to them, but I forgot about the early mornings. But it just kept getting worse and worse. And then so the doctors weren't helping me. So I snuck off to an integrative alternative conference. I'm like, oh my God, this is more evidence-based than what they're teaching me. And so really at that point, so I went on like high dose T3, thyroid replacement. And my levels were very low, but normal on the TSH, and some immune modulators, not a lot of anti-infectives, but that I just go, oh my gosh, I'm back. And then, but all of a sudden I went through a stressful divorce. It's that emotional stress. This really kills the immune system. Bedbound, Lyme, Babesia, Bartonella. And then I went into heart failure from the high human challenge growth factor beta. It causes fibrosis. My heart was fibrosed. It was just like it was a severe diastolic dysfunction. It couldn't fill. I could not stand up. I could not go upstairs. And the cardiologist said, maybe in 10 years you can get 10% better. I'm like, I cannot live like this. There's just no way. So I just put a date and said, Lyme's bad enough, but when you can't breathe, it sucks. Oxygen's nice. I said, I'm going to go around the world and see if I can, cure myself or dramatically improvement because they say I can't 10% in 10 years. And if not, on Halloween, that's it. And I was thinking, who am I going to take with me? Uh, but and so I was like going around. I did some great stuff. I got Omar Morales. We basically I took Lyme antigens down, and we basically took out my white cells and stimulated them to the antigens and worked well, but it kind of didn't stick. And then went around. I went to Belgium. I was running around there. I did peptides. I didn't even think of peptides would do anything. I didn't really know much about it. And then like 3 or 4 days later, I walked up the stairs. I'm like, wait a minute, what the heck was it? I don't think it was a peptides. Then went back, and it turned out it was. And it took about a year to get them into the country. Then I kind of hooked up with Tailor Made at the time. And
By
then
the
it
way,
just kind of
I
took
did
off.
my medical training in Belgium for 7 years. Who's the doctor who gave you the peptides in Belgium?
I think it was Hertog actually.
Right. It was Terry
Yeah,
Hertog, right? Yeah, because Terry is
yeah,
the one who had trained me years ago talking about these type of things.
yeah. He's awesome too. He's been doing this stuff. And yeah, he was based his whole family's psychiatry, but he turned endocrinology so he can do more of this type of stuff. And then so I'm like, oh my gosh, I'm just changed. But and then that's when kind of then I went into the heart failure and stuff, and then went into family practice because I hated anesthesia. I'm like, oh my God, this nothing against anesthesiologists, but this is mindless. And so went to family practice and started treating the complex illness. And I knew nothing about marketing. I took over a family practice and converted it to cash in a year, and no marketing, just people lined up, just outside because especially we're doing thyroid optimization and not even some of the big guns. We first started, we couldn't really even get the peptides, but thyroid's huge. But then you add the peptides onto that, and it allows you to go with these complex patients instead of, uh, you know, 3 year, 2 years of high dose IV antibiotics is maybe you need 3 months or maybe none at all. And, with immune modulation and kind of working on these things that when, basically a big thing with these Lyme patients is that, well, we'll kind of go back, like what's the immune system oversimplification, any model of the immune system's oversimplification, but there's Th1 gets stuff inside the cell. TH2 gets stuff outside the cell. You can add Tregs over here, TH17. As the thymus involutes in your chest and you get older, it goes like this. So the TH1 goes down, the TH2 goes up. So you can't fight intercellular infections. You can't fight, cancer, but you have all this inflammation. So you tend to get autoimmunity and all this stuff. And then any stress, inflammation, sickness, age, it just keeps going like this. So if you just uh, and then there's a vicious cycle. So with the immune dysfunction and this increased inflammation, you get pineal, hypothalamic, pituitary, thyroid dysfunction, other hormone dysfunction, mitochondrial dysfunction, and that's a vicious cycle. Now, and also you can't perform autophagy where the body renews the cells if you don't have high TH1. You can't convert IgM antibody, which is a weak antibody, to IgG. So like when I first tested, I was positive of 41 kilodalton band IgM. Like, well, it's false positive because you've had these symptoms for a long time. As soon as I fixed my immune system, I had 6 bands IgG. So it's able to convert. And it allows, like we have, POTS patients and, mast cell patients. And if we fix their immune system, instead of like fixing this, all of a sudden, like we don't even think about POTS anymore because it just gets better when you fix the immune system, which then feeds onto the mitochondria, which then feeds onto everything. And then you can boost all these different sections as well with peptides. And we'll talk about what peptides are coming up.
So you really came to this because you were sick yourself with chronic Lyme and associated problems. And by the one, the TH1 that you were talking about with intracellular is, of course, Lyme disease, Borrelia burgdorferi, and Bartonella henselae, and all the Bartonella species
Yep.
intracellular. So if
The
your immune
quintessential.
system is not working to clear those intracellular infections, it's true. I mean, people just have ongoing inflammation that never gets better. So, it's actually wonderful when a doctor, that's wonderful that you got sick, but when doctors have been through this themselves, and they understand from a patient's perspective how sick someone can get with chronic Lyme, you had to go on your own healing journey to figure out how to get yourself better. And by the way, some of the greats in medicine, that's exactly how this has happened. So let's dive in exactly as what are peptides? What are bioregulators? Like what exactly did you
Yeah.
discover and why
Yeah.
is it so important in the chronic Lyme population?
Yeah, and I just want to mention in regards to the immune system is that I did 3.5 years of the highest dose IV antibiotics I would never give to a patient. Six, five, six, seven at a time, 3, 4 times the highest dose. Just nothing because my natural killer cell function was zero. And I would get septic like every few months. I remember I was at Torrance Memorial in the ICU, and the nurse doing this shift change. They go, "This is that AIDS patient that keeps up turning negative for HIV." Yeah. So it is like you saying it's so low, but yeah. So what is
Well,
a
if
peptide?
you were at death's doorstep, you're certainly looking great now. So whatever you've been doing, you better share it with the audience and tell them what it is you've done.
Yeah, I've almost said I died a number of times. Um, but what the heck is a peptide? People hear it, and I think a lot of times, collagen peptides. But a peptide is basically a chain of amino acids, like a protein, but just arbitrarily, if it's over 40 or 50, depends who you ask, it's a protein. If it's less than that, it's a peptide. But the ones that we generally use are smaller, like BPC 157, body protection compound 157, probably the most common one. It's kind of like to do everything, like lowers inflammation, great for leaky gut and fixing the gut. KPV, which is a 3 amino acid fragment of melanocyte stimulating hormone, and all those. So those peptides work on the cell surface. So you give them, they go on the cell surface, they attach to a receptor, have secondary messengers. They're pleiotropic, meaning they have a lot of effects. They're like supplements, rather meds tend to do one thing, which you think would be safer, but it does, it makes it kind of throws everything off where like with BPC, it does so many things. It will protect against toxins like mycotoxins and like EMFs even. It blocks the calcium channel, hyperpermeability. Like we had my son, we put him in the room with the router, which was really bad with the EMFs, and he's just getting all these panic attacks and palpitations. So we gave him BPC and then the heart bioregulator. And it was like he got a beta blocker. So like they're kind of the all tools. Now the bioregulators are a peptide, but they're different. They're a subset. They're by definition 2 to 4 amino acids long. Why does that size make a difference? Because now, if they're capped, meaning that if the body, for instance, if there's a protein or a peptide the body thinks is important, it will cap it in the gut. So it puts a acetylate and amidate a cap on it, and now the enzymes don't recognize it in the gut. It's not broken down, and it makes it more bioavailable. So all those are capped, and they're so small they can get through the gut wall and then through the cell into the nucleus. Now, we said the peptides work on the cell surface. These are different. They go into the cell, into the nucleus, and then they'll attach to activators or repressors and change protein synthesis. So they're basically epigenetically. So they're turning on genes, turning off. And the good thing is they're turning on youthful genes, healthy genes, and turning off the basic unhealthy inflammatory genes. So
So,
that
so
they
which
work
one of
very
these,
different.
since everyone's listening, everyone's saying, hey, I want those things to go into my nucleus and give me longevity and health and, anti-aging. What are the ones we're talking about here that you found to be some of the most effective for that?
Yeah, so it's an interesting history, and they have 21 of them, right? And so they're very, for each tissue, they're very specific. So, like, and if you look at, they'll increase protein synthesis and affect the genes in their tissue. And there's some overlap, but they're much more specific than hormones or supplements or standard peptides. And like, how did people find these things? So during the Soviet Union, they found that their submariners, their high-speed jet pilots, and their wait, who else was it? No, they're astronauts. Yeah, the cosmonauts. They're aging very quickly, and they're like, "Hey, we gotta do something." So they went to the basic military hospital, and who was there was Pavlov, as in Pavlov's dog, right? Him and Cavison, who was the head of it, and they must have been doing some things with peptides because they didn't. They seemed to get very lucky and pick right off the bat. But they found that if they use extracts from basically fetal sheep or cows of the pineal gland, which is kind of right in the middle of your brain, the third eye, they'll say, and controls a lot of things. We used to think it was just sleep, but it does so many more things. And the thymus, those two actually dramatically reversed that rapid aging. And so and actually Cavison, who's head of that, he's KGB as well.
So
And
people that know about anti-aging, like rapamycin and metformin and some of the things that are out there now, you're saying there's actually other things you can do with these bioregulators that instead of using rapamycin or glucophage metformin, these are actually things that have also been proven. There are scientific studies on these.
Oh, and it's nice. And there's thousands of studies on these things. So
Wow.
no one knew about it because it was a Soviet secret. It was only given to the military and the Olympic team. And the Olympic team did pretty well during that time. And then it wasn't until the fall of the Soviet Union they started publishing outside of the military secret, but it was in Russian. Who cares? And then people started translating, like, wait, what's going on over here? So over time, it started getting really incorporated, and there's literally thousands of studies on this stuff, and I was just blown away by it, and it's really changed our practice. Peptides changed my life, changed so many doctors and practices and patients' lives, and the bioregulators are now an additional thing. It's just like, damn. And so we have a number of studies on these things. So they've been doing them for 40 years, but not telling anyone about it.
So the ones again, so I heard earlier the BPC 157 is a good general one, right? You're saying
Yeah, but yeah, that is
anti-inflammatory
not a
help.
bioregulator, though. Yeah.
Right, that's not a bioregulator. So what are the names of the bioregulators that you're talking about specifically?
Well, yeah, they're all in Russian, right? And that's the
Okay.
problem. So they came out all in Russian. Their names, like, it's like, what the heck? And it's like, and it's basically like, the brain one. They have two brains. They have the cortex and the subcortex, the pineal, the thymus, muscle, lung, bronchi, all those things. So finally, it's called Nature's Marvel. I actually put English names on it. But still, you have to take, there's 20, okay, you want to treat your lungs, you want to treat your heart, you want to treat your muscle. It's like, so what we've been doing, and there's also, then you got to take in the fact that there's natural, which they take extracts. And then they found on some of them, they were able to identify the active component and then purify that. And then it makes it much cheaper to synthesize that. And it's actually much more potent, it's much more rapid onset. And then we can combine those and use three, four, five, six, seven instead of taking seven pills and at one-fifth the cost. So it's really nice to be able to do that, and it makes it easy because people are like, oh my God, what do I take? That this and this and this. Like for the vessel one, which lowers the inflammation of the vessels among other things, but you combine that with other ones, and it just makes everything work so much better. Um,
So these might be even long COVID patients that have and,
exactly. I knew you as soon
and
as I mentioned it, I knew it was like, yeah, and
endothelial dysfunction, right, where
yeah.
the vessels are not working correctly.
Yeah, it's like ideal for this stuff. And then we just discovered a mitochondrial bioregulator and a couple stem cell bioregulators. And it's just exciting. I think it's a really exciting time to, be sick, I guess. But or if you're looking to increase longevity and, quality of life, that all these things are coming down the
So,
pipe.
Ken, this is really exciting stuff. And I mean, really exciting. And I'm kind of surprised. I mean, I've heard about them over the years, and I actually have taken a course with you years ago. I took one with Thierry. I think it was A4M. I met you years ago and I listened to it. I've studied with Thierry also one time. I don't know that this almost feels like it's one of the best kept secrets
Yeah,
in
like this stuff
medicine.
is pretty new. Like
Yeah.
peptides they've all been around a long time, but it's just not here. And kind of with the BPC, and of course, if something's safe and effective, they want to ban it. And so they banned, the compounding pharmacies are making the injectables, but now all the manufacturers just come out. There's more of those available. And then these are separate. They're supplements. So
So these are
uh,
oral versions that we don't have to worry about FDA regulations and things
correct.
specifically
Yeah.
with it.
Yeah, I was able to hire a giant team of FDA attorneys to make sure it gets done. Yeah.
So great. So why don't we dive in a little bit? Why don't you, I know you've got a slide presentation for us to kind of give us more detail. Why don't
Yeah.
you share your screen and I'll go back and forth with you a little bit as you share some of the information there.
All right. Just kind of, yeah. So this is just I love this slide. This is the history, the future of anti-aging medicine. Um, but and so with all these bioregulators, they're just so amazing, and we're discovering new ones. And this is just talking about longevity, where we're able to put so many different things like 7, 8, 9. In fact, we have to do 3 formulas with all the different tissues, because we'll look at a study that's been ongoing, and mostly it's mostly doctors enrolled, where they're checking their the biologic age versus their chronologic age, and see how much they can get a reduction in their biologic age. So we're starting a program where we're going to guarantee 5 years reduction in biologic age. We'll see if it works. We have to give a lot of refunds, but and so here, brain vessel, the pineal gland, and then stem cell ones, mitochondrial ones, cartilage, and just like every tissue. So the more that we can combine together, the better. And so this is one of the studies that's been ongoing. This one is from Russia, but there's so much collaboration now. And basically what's called the telomerase activation protocol. So ways to determine biologic age versus your chronologic age. So let's say you're 60, but what's your biologic age? So you look at the telomere length, and for instance, when we looked at all the special forces veterans, they're in good shape, but they're a mess. They were totally disabled, traumatic brain injury, post-traumatic stress. They had the lowest 2.5%. Their telomeres were so short, it was incredible. But and there's just some things that can increase the telomere length. And telomeres are, every time the cell divides, there's kind of like caps, like think of the things on the end of your shoelace, that basically every time it divides, that it gets shortened. And if you have inflammation and stress and toxins, chronic infections, they basically don't regenerate. There's no telomerase to basically lengthen those again.
Right. So for those
So
listening, we're talking about the ends of the DNA. So in other words, every time the cells turn over, each time they turn over, there's a certain amount of cell cycles theoretically that a program that you're supposed to have, 70, 80, whatever, it keeps getting shorter and shorter. And if we can find a way to reverse that, obviously you're going to live longer and be healthier.
right. And then also they're finding that when your telomeres get short, that's when you get cancer. They're finding the people that had increased mortality, morbidity with COVID, they had short telomeres. So it's really sick patients have short telomeres. And so there's a peptide called epitalin, which is pretty dramatic. We'll look at. So they were looking at this time, the telomere length is a marker for your biologic age. You can also use methylation of the DNA is another marker. And then there's also biologic markers that they use, all these different formulas. So in this study, they wanted to reduce the biologic age less than the chronological age by 7 years. And when you do that, you get a 50% reduction in mortality in morbidity, excuse me. And so what turns out after a year, they reduce their, 2 years, sorry, 3 years, sorry, they reduce their telomere age by 22 years. And with an average of 7 years, 7 years per year. And there's mostly doctors in this, and it was over 100 participants, and now most of them are on a maintenance program. And then there was an additional one. This was done in the U.S. called the Epigenetic Methylation Analysis Intervention Study, where it's 3 to 4 year study, and look to see if the peptides can reverse the biologic age doing the telomere length, and also the methylation of body will methylate certain genes in which they can determine what is the biologic age versus chronologic. So the average participant had a baseline epigenetic age, again, biologic age 3.5 years older than their chronologic age to start, which correlates with about a 40% increase in risk of mortality. And then on average, the participant reversed their telomere age by 14 years over the 5 years of this, and the epi age by 2 years. So that takes longer. It's a different test. It's not like one's more accurate, but they're different measures of different things.
And
So
you're
over
talking here,
90%.
and by the way, you're talking the bioregulators here. These are not the peptides. These are the bioregulators, right?
Correct. Yeah. So these are all the Russian bioregulators. These were initiated in Russia. So all the ones like, yeah, pineal, brain, thymus, muscle, lung, pancreas, kidney. Like the kidney one, I mean, I have chronic kidney disease left over from Lyme, Babesia, Bartonella. My creatinine's like 1.3, 1.4. And it was a little TMI, but when urinate, there's foam in the bowl because I'm dumping protein. But if I take a kidney bioregulator about 6 to 8 hours later for about 3 days, no protein. And we've given it to people on like dialysis, and they're getting off dialysis. I gave it to one of our MAs, to her mom who's on dialysis, and I forgot about it, and she kind of forgot about it. And her mom goes, "Oh, the doctor said he's never seen anyone, get off dialysis." I'm like, "Oh shit!" And so it's incredible stuff. And so in this study, over 90% of the participants had their telomere, basically reached their telomere age goal in 2 to 3 years. And so they're still on maintenance. Now, this is actually, this was not through this study, but this was study looking at, they gave patients with significant cardiovascular disease, they gave them only 6 doses of epitalin, which is the pineal bioregulator, and a thymus peptide, which is a bioregulator of the thymus. And then they followed them for 12 years, elderly, which is 60 to 74. And they found that the ones that didn't get the treatment were on standard treatment. They had a 41% chance of mortality, and ones that got the bioregulators, 17%. And then that was just on epitalin by itself, just the pineal. Then if you added the epitalin and the thymus, which is what the Russian cosmonauts and the submariners got, that when they just did the epitalin, and these are the older patients, 75 to 89, from 77% risk of mortality to 41%, and on both of them, 28%. And these were the older patients. They also found that their cardiovascular the system actually improved rather than declined. They had dramatically less cancer, less chronic infections, increased quality of life. They had increased bone density, all these things.
And that's in part because the thymus gland, again, you were talking about it earlier, regulates T cells that are needed for Th1 for going after intracellular infections like chronic Lyme and Bartonella and the rest.
Exactly. And so here is like looking at, these are the genes that is involved. So this is the lyse glue. It is the thymogen, which is orally bioactive, just 2 amino acids. And actually, it orally was actually more potent than thymulin, which a lot of doctors use as injection to modulate the immune system. It's 100 times more potent orally than the injection. And then this is the epitalin, which is the pineal peptide. And just to let you know, there's pinealian, which it's pineal peptide, right? Nope, it's a subcortical brain, so it gets confusing, but does have a lot of pineal effects. But so this is they looked at the mitochondrial genome, which we know mitochondria with Lyme is huge. And so this is epitalon and called Vilon. And that's in our Vimogen alpha 1. And expression of 5 to 13 genes increase expression by 2 to 6-fold, and 4 of the genes reduced 1 by 55. So they also inhibit pro cancer genes and that. So you can see like there's overlap, why there's synergy and how they work together. And so this is looking at just melatonin levels and epitalon. Like it's funny to go simplify. Well, it's because it raises melatonin that has all the effects. Well, that's just a kind of a nice little perk. But you can see here, young patients that get it with the orange here didn't raise it. They don't need it. It's high, and that's the nice thing with the bioregulators. Like with the thyroid one, if your thyroid's low, it raises it. If it's high, it lowers it. And kind of the basically modulators. And this is the older patients. You can see their melatonin level low, and then goes up to here. And then this is an increase in this animal study, but just showing here that just giving thymus the basically increase in longevity and giving the pineal a dramatic increase. When you combine them, you get even more, as we saw in the previous. This telomerase increasing, basically the enzyme that's increasing telomeres, and epitalon is huge for that. You can see that there. And this is like the pineal to make it easy. People are so freaked out. The nice thing with the peptides and the bioregulators, you can't really screw up because you can't overdose, and that you can give 1,000, 10,000 times the dose, and it's nothing happens, and I know no negative. It's you wasted some money, but try that with water, you're dead, right? So it has the extract in it, and then also these different bioregulators. Again, the vessel makes everything work better. And then this has these pineal bioregulators. And we just launched this one I'm very excited about, and it's kind of amazing. I'll go through that. You have any questions, Horowitz? Anything
No,
from?
no, I mean, I have to tell you, and I'm glad that they've been publishing some of these. The kind of studies that you're showing here and the results are so amazing. It's almost like I feel like everybody listening to this is going to jump on these, in fact, myself included, because my whole family died of cancer. I mean, I am taking things like broccoli seed extract, sulforaphane glucosinolate, right, to hit the P53 cancer gene, suppress it, open up my phase 2 detox. I'm doing these type of things myself. I'm just not necessarily doing them with peptides. I didn't realize, right, the effects and the power of what this is. Now, question, you were showing studies on this. How many studies have actually been, published in peer-reviewed medical literature, for example, on patients who have taken these?
Thousands.
So why is it we hear about things like rapamycin for longevity and we hear about glucophage metformin, but you don't really hear much about bioregulators and peptides? You have a sense why, like, it's been almost left out of the mainstream medical discussion?
Yeah, well, we're having so we have hired a Russian to translate. So, it's just it's difficult to find the stuff. But yeah, it's exciting. But it's like anything, it's not like you look at what doctors know, and you look at all these annals of internal medicine found most doctors practicing 10 to 20 years, what's available in the medical literature. It takes on average a proven new therapy to be accepted into mainstream medicine 17 years. And they say, why is that? One, doctors don't read medical journals, but that's not even the biggest reason. The biggest reason is if you give a doctor, here's 50 studies showing what you're doing isn't optimal, here's a better way, they don't want to hear it. Like, no, 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 my patients are fine. And so many doctors are just doing what they did in residency, and it's like 10, 20, 30 years later, and they will defend it to the death. And that's the biggest problem, actually.
No, and I know from some of my colleagues, Tanya Dempsey, for example, I know she's using peptides, and she's told me about some of the positive effects that she's seen.
Well,
Um,
it's funny.
I,
There's it was Rebecca Ferguson, and she has had a blog or whatever. I don't know all that stuff, but and she's an autistic child, and so had a big following, and then she got long COVID, and which then all of a sudden she's posting, and all these people are following, which I don't even know all that stuff, but and then she took KPV and just reversed all her symptoms. And then so she's giving it to all these people, and they're like, "Oh my God, it fixed me in 3 seconds." Like I'm like, "Stop! It looks so fake, you know." And these were hundreds of people, and we're like, "Don't put those up. It just looks bad."
You're
But
talking kids, actually. You're talking kids with autism.
oh
Um,
no, no, yeah. So she had it. That's why she had the blog. But these
oh,
were
okay.
all long COVID.
COVID patients, but she was fine. Was
Yeah, and so she took that and it reversed her symptoms, and people were like, "Oh my God, I'm better." And like, it took half a day, and I'm like, "No, don't put that." And but like we rarely see side effects from peptides, especially bioregulators. But all these, multi-system, multiple chemical sensitivity, and some people were reacting to the KPV like, "Oh my God, I got anxious," and like never seen that. But it's kind of like the person being allergic to epinephrine or cortisone. But uh,
is anyone doing a clinical trial for KBV at this point for long COVID?
I don't know anyone.
Okay.
Yeah, and there's so many great things for long COVID. In terms of, I remember we had a Christmas, it was the last couple years ago, Christmas party, and an MA ended up spending the night. She drank too much. I go in the other room. She's like, "I can't breathe. I got long COVID." Like, why didn't you say anything? And this was before bioregulars. I gave her a shot of, I think it was Epitalin, whatever had uh, BPC, Epitalin, TB4 frag, KPV, and she said she woke up the first time was able to breathe. And so the immune modulation's huge, and mitochondria, and able to clear the infection. But it's exciting times.
Yeah.
So the thyroid, and I've been a huge advocate of thyroid, and we have the National Academy of Hypothyroidism, a nonprofit, which really shows the way that we diagnose and treat thyroid in this country is wrong. And all these Lyme patients that come in, and they can go to all the great doctors, and we got the top of the food chain here. But if they miss the thyroid, it could be that missing thing. And we find that anyone, and I've done a lot of review articles, and they're on the, again, National Academy of Hypothyroidism, nahypothyroidism.org. And because people look at the TSH as the marker, but someone with low thyroid from chronic illness, they actually have a low normal TSH, a high normal T4, because the thyroid is active transport. It needs energy to get into the cell, especially T4 more than T3. So the T4 can't get in the cell, so it goes up in the serum, and people, "Oh, you're high thyroid. You got low normal TSH, high normal T4." No, it's the opposite. Then you check their free T3, and they're low normal, and then reverse T3 is high normal. It used to be abnormal, but they switched the assay from radioimmunoassay to LC mass spectrometer. But and in fact, like with depressed patients, you'll see that exactly in this, like the STAR report, largest study ever done on antidepressants. They did like essentially every antidepressants and had this big algorithm, and they put T3 in the mix. I don't know why, but they did it. And they treated them with T3 along with the antidepressant, or instead of, they were in different groups, regardless of their baseline thyroid function test. T3 outperformed all the antidepressants with less side effects. But they didn't put it in the abstract because they didn't pay. And then also like a study, small study of 135 patients with treatment-resistant bipolar, which we see a lot, Lyme patients, brain on fire stuff. 135, they tried on average 14 different medications with no improvement. They just gave them all T3. Hey, just here you get T3. 80% improved significantly and 25% total resolution of symptoms. And that's just the depressed side. You look at all these other things, fibromyalgia, and everyone's low. So what we do, we'll check because everyone has a normal TSH. And if someone is dieted more than 3 times, if they're stressed, if they overtrain, if they're overweight, the body, you get a combination of basically central hypothyroidism and then also systemic, where you get the deiodinases get screwed up, the transport system gets screwed up, so you don't transport it into the cell. So type 1 deiodinase transports, it converts T4 to T3 in the systemic system. In the pituitary, it's type 2. So with chronic illness or inflammation or stress, it suppresses type 1 deiodinase, so there's no T4 to T3 conversion in the body, except for the pituitary. The deiodinase type 2 is upregulated, so you get more T4 to T3 conversion in the pituitary. So now the pituitary sees more thyroid, the TSH drops. So it's people think the TSH is the, quintessential thing. It's not. It's missing so many people.
No, and by the
And
way, in our patients, almost every one of our chronic Lyme patients has low TSH, really low. I tell people in chronic Lyme, because of inflammation affecting the HPA axis, the
Mhm.
hypothalamic pituitary, you cannot rely on the TSH in chronic illness because it's suppressed all the time. And I tell people it's not a marker for hyperthyroidism. You've got to look at the T3, free T3, and all the rest. And so 100% agree with you. We see this all the time.
Yep, and totally, and just giving that back to them. And so what we'll do is we'll check their basal metabolic rate coming in, and we find they're on average about 25% lower. So they're burning 25% less calories. Their mitochondria aren't working, and they're not making any energy. They compared to someone their same age and weight, 25% less is huge. And we'll also do what's called a thyroflex. The British Medical Journal showed that a knowledgeable doctor looking at someone's ankle reflex is a better test than the blood test. How could that happen? Well, a normal thyroid, a normal reflex of, let's say, the ankle or brachioradialis goes, but the lower the thyroid, the slower the relaxation phase goes, and then the computer measures that. And so some good studies on that. But now we have another tool for people with low thyroid and Hashimoto's. Um, so the thyroid, think about thyroid bioregulators and thyroid axis bioregulators. So they're basically from the basic glands of that reduces the thyroid nodules, prevents stem cell aging. Then this also activates telomerase. But let me just kind of go quick here. This is a small study, but they all fit. And so basically, they compared someone with low thyroid, and in this study, they just gave the thyroid bioregulator, not the thyroid axis, but they did not have Hashimoto's, they did not have autoimmunity. And let me just go to the graph to make it fast. So here's before treatment. This is their T3 level and the T4 level. After treatment, conventional, which is giving thyroid. But if they add that to the thyroid bioregulator, it went up even more. The nice thing is, if you're high thyroid, which we don't see as much, then it lowers the thyroid. And if it's low, it raises it. And you can see, and then this next one was looking at a thyroid bioregulator versus the thyroid axis bioregulator. And in these patients here, again, they also had Hashimoto's. You can see they have, the TPO antibody 357. And then so the first group, they got standard treatment. Second group, the thyroid bioregulator. Third group, the thyroid axis bioregulator. And so the T4 before standard, again, they didn't go up much, but you can see higher. TSH drops down, which you would see. And what's interesting too is the patients that when they take the thyroid axis bioregulator, they're low, their TSH goes up. They're like, oh my gosh, I'm lower thyroid, but I'm feeling better. No, because it's fixing that central hypothyroidism. And
Right.
actually, in the Samhain study that all the endocrinologists point to, like, oh, don't suppress the TSH because it's going to cause AFib. And you can cause AFib with giving massive amounts of thyroid, but also low thyroid increases the risk of AFib. But the Samhain article, they showed that people with low TSH had increased risk of AFib. But I contacted the author and dug out the data, and everyone that got AFib was not on thyroid. It was people who were chronically ill, most of them with heart issues. And so it showed that the chronically ill with heart issues were more likely to get AFib. Hello. And no one on the thyroid group with suppressed TSH had AFib. So it's actually the opposite of what their conclusion was. It was protective against AFib. But see, it's just crazy. And they'll say, "Oh, bone density loss," and which is not true. A antidepressant has higher risk for bone loss than suppressing the TSH. So it's crazy. And then here's the big difference is the antibodies. And we found that, fixing and anyone with Hashimoto's or even low thyroid, T3 is the way to go. And that's a whole nother lecture. I have a 3-part lecture, it's about 6 hours. But and if
Why don't
you
we stay on the line? And just for everybody who's bored, why don't we just stay on the line and do this for the next 6 hours? Because you are fascinating, Ken. I got to tell you, this
Oh
information.
wow, coming from you.
Oh no, this information is it really is fabulous. I know
Thank
we're going
you.
to do this for about an hour today, but You and I are definitely going to connect afterwards because this is really amazing information.
Awesome. You're making me happy.
Yeah.
Yeah, and so you can see here with the standard group, it doesn't affect the antibodies. In fact, endocrinologists don't check the antibodies because they don't think they can do anything about it. It's crazy. And actually, with we take the course, you look at Hashimoto's patients, they have the highest incidence of anti-pituitary antibodies and mitochondrial antibodies. And we found, I'm a big proponent of T3, but patients even the correlates even more than their level of thyroid is their level of antibodies. And I'm sure you've seen that, this autoimmunity and inflammation, it's just a vicious cycle. But you can see with the thyroid axis bioregulator, it dropped it. And this is something untreatable, according to endocrinologists, from 87 to 18. And then the anti-TPO here. So dramatic reduction. So this has the thyroid axis bioregulator, thyropep, has the glandular in it, and then three different thyroid axis bioregulators. I don't think anyone knows. But yeah, we can go on to brain. Brain's such a big issue with all the Lyme patients is just brain fog. And I remember, I had the worst memory of anyone I've ever met. Growing up, I had congenital Lyme, Babesia, Bartonella. My whole family had it, but we didn't know. My mom, we just thought, well, she's a sweating machine. My dad had chronic fatigue syndrome before it was chronic fatigue syndrome. But I remember I'd go to dinner and my wife would talk about someone I never met. I'm like, you went to dinner with them last night. It's scary. But any thoughts or questions or?
No, I mean, I'm just thinking back on the last slide you were showing about the autoimmune, thyroid markers with antithyroglobulin, antithyroid peroxidase. We see these, of course, all the time. In fact, those are most common autoimmune markers that we see in chronic Lyme disease is basically the thyroid autoimmune markers. We see it all the time. And I know from the prior, endocrinology papers that they've now, of course, changed it where they want the TSH, 2.5 is now kind of the new one, not 4 to 5 the way it used to be. But because we do see suppressed TSH from chronic inflammation, I did not think there was anything we could do to reverse I was just thinking to myself to reverse some of these autoimmune manifestations. And I realize now what you're sharing is this is something now I need to be looking at more in our chronically ill patients. So no, I was just reflecting on that from the prior slide, but please go on because this is really fascinating.
And actually, I've been trying to develop the last 10 years bioactive TSH, which would replace the TSH and all its shortcomings. And went around and we've had the most mishaps. Like we got someone LSU working on it and his house got washed away and it was just like incredible. And then we went to a place in Bilbao, Spain, and they were doing it. But then they go, oh, we need a mass spec. There's only one in the country. Like, but I think I'll present this to you and it will replace the TSH. But anyways, um, and so yeah, brain is so huge with patients. Oh, I was going to mention, yeah, and what you've probably seen this too. It's like, and it's like all kind of waves of different autoimmunity. Like, oh, I have antiphospholipid syndrome this week, and then I have, but it never fits into that little, basically bucket that they want. But they come and go. And for instance, like when I was doing like 50 shots a day of peptides when I started, and just reacting to everything. And I'm like, oh my gosh, this stuff's bad. But and over time, then it stopped because my immune system was just so inflamed. It's like these multiple chemical sensitivity patients, their Th2 is so high, it just reacts to everything. So mast cell activation, you modulate that. Now the mast cells are suppressed. And the mast cell docs, God bless their heart, it's like the subset of the worst Lyme patients, and they're all going after direct suppression of the mast cells. But if you go upstream, you just have so much more, basically, better outcomes. And even stuff like if you look at those patients, will generally have high ACTH and low cortisol. And I know, okay, but their high ACTH is from high corticotropin releasing hormone, which is a direct, super potent stimulus of mast cells. So you're trying to suppress these mast cells, but you got CRH just pumping out. And that's when, we used to give a little cortisol with like Jeffries, like 10 to 15 milligrams to help. But now we can give the adrenal bioregulator and that normalizes oftentimes.
So you're talking about the adrenal bioregulator for even mast cell.
Yeah.
Huh, interesting.
Yeah, and you'll find like some interesting things like the cartilage one will work. So they're specific, but they also have all these different effects. Um, so this is the bioregulators for the brain, cortigen. Now there's cerebrolysin, which is basically ground up pig brain. It's been around 40, 50 years, approved in 54 countries, never any issue. Um, and so it is, they don't even, no one knows the formula because they hide it. They just put the amount of amino acids. But it's also, we in the supplements, the oral version of that, which is actually bioavailable, which is the Shrevepep. And then the pinealian and the cognipep, it's not a pineal, it's a subcortical and has some amazing properties. But just to try, because everyone gets confused on that. But this is just an interesting thing. This is just asking the patients when they treated them just for 20 days with neurodegenerative diseases. Well, I don't know how well they could respond, I guess, but was it good? Was it okay? Was it or unsatisfactory? And then with standard treatment, they had 27 thought it was good, 65 with the cortigen bioregulator or this placebo, sorry. And then again, satisfactory, 20 was 40. And then so you can see how the treatment looks what you see with treatment, but the placebo looks like a placebo with the bell shape there. And then they looked at all these different symptoms with people with and it was kind of I think there was too much of a mix, but it was people with post-stroke, with dementia, with, Alzheimer's, and a lot of different things. But headaches, very common before treatment, after using the conventional, and whatever that is. And then with just the one single bioregulator, we're finding the combination of bioregulators is really where the power is. And I'll give people 10, 15 bioregulators the first visit. And they do fine, but that's the problem with them is that, okay, you're taking this, 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 this. And so we're combining those like, oh, just take the brain one, and it combines a bunch. But so that went down to 34% sleep, which is huge. And I still have a problem sleeping because I think I was born at 6 months because of Lyme, and I think I'm burned out my sleep center. But yeah, there's some great things for that. Emotional layability, memory. You can see just improvement across the board, and you can see the graphs here. How just with just one bioregulator, the pinealion, which is the subcortical brain, significantly increased. Then they did EEGs. Okay, so in case there's some bias there, and looked at. I think it's kind of cut off there, but whoops, shoot, where'd it go? Back.
By the way, regarding these porcine or animal-based products, people always ask the question, and I always check about prions. They're coming from places where they've made sure there's absolutely no prion disease. Because, for example, some of the glandulas we've looked at in the past, it's only from like New Zealand or Venezuela, places that they've never had a case of it. Is it the same situation?
Yeah, and so Ever Pharma, which like with the cerebrolizin, they've been around 50 years as injectable, and basically tons of studies on dementia, giving it IV. I'll give myself IM a couple times a week. No case of it. And then the pigs are actually resistant to prions, and so there's no mad pig. There's like a angry pig, but no mad pig. Um, but yeah, so here's it's cut off, but the confirmed it with EEG changes. So there's a normal person up here, and then with conventional treatment, really no change. And then, but you can see with the uh, basically the increasing EEG. So this is combining those different ones there. And this is again the cerebrolizin. I'll just quickly go through this. It's a mix of different basically bioregulators and peptides from the pig brain. And we actually did a natural BPC where we collected it from the gut. Man, that is horrible, horrible. But I would frown on to your point is some people are they say cerebrolizin, but it's a compounded version. And so I don't know what they're doing, but they're putting it's cheaper in a vial. But when we did the natural pig from gut, it's like, oh my gosh. And each bottle ended up being like $1,200. But if in pig brain, oh, it's bad. It's bad. So you want to go with cerebrolizin, go with the manufacturer. And I can't believe what people are paying for it, but it's worked for autism and so it's so many things. And this is again the oral version, and where they found that just a single dose, significant improvement. And then the nice thing is, if you take the brain bioregulator, compare it to the cerebrolizin, 100 micrograms, okay, micrograms 1,000 times less than a milligram, compared to 200 milligrams, it was equal potent. So yeah, so basically, 2,000 times as potent. Kind of cool stuff. And then we'll just kind of go on. There's so many different areas we were kind of deciding before. Okay, what do you want to do? This is kind of neat. We do a lot of fertility. And what we found, this is before even peptides, but we were doing peptides 20 years ago. We didn't know they were peptides. We called them cellular peptides, and they were doing them IV, but they were working amazing. And then we couldn't get them from Germany because they were too effective, and the government didn't like it. And then they resurfaced again. And we're finding that what we were doing, if you fix someone's thyroid, give them T3, let's say, especially they've been to all these fertility clinics, and their anti-Malarian hormone's low. We can raise their anti-Malarian hormone now, and also get them menstruating. For instance, when they gave, this is a rat study, so it will work on attorneys, same. And they gave all menopausal rats the epitalon, the pineal peptide. They all started menstruating, and 25% had live births. And so we're treating humans with it, but even before this, we would give them T3 and heparin, especially if they had an early fetal loss. And if they have early fetal loss, normally what's going on is immune activation and coagulation. The vessels are very small and they clot off. So you give them heparin, and then T3 kind of starts all of a sudden. We talked about everyone's low thyroid. And then they all of a sudden they've had 3, 4, 5 in vitros, and they get pregnant naturally. Now that we have the peptides, now all of a sudden their hormone levels are going up, their FSH is coming down, their anti-Malarian hormones going up. But so we'll take just a quick glimpse into this. So this was an infertility study, and looking for people who are menopausal with ovary and pineal bioregulators. So these are 214 women, 34 to 38. All these patients were trying to get pregnant. And they found they had reduced hypothalamic pituitary estrogen axis, which even the fertility docs will never tell you that, because they don't even, what is that? So it means that they basically have the low, there's a central component, not just the ovaries stop working and the FSH, LH go up, the body's going, the brain's going, give me the estrogen, give me the progesterone. It's both. It's like, oh, we don't care, we're lazy. And the treatment group received ovarian bioregulators and the pineal, and again, did blood work there. And so normal range, let's see, before treatment, FSH 6, LH, estrogen, so 49, it was kind of like the male range, anti-Malarian hormone 0.74. And they also did ultrasounds, look at their antral follicles. After 2 months, the FSH went up, which I mentioned because it's stimulating that. That doesn't mean they're worse, especially if you look at their estrogen level. Look at the estradiol level, 243 from 49. You're not giving estrogen. Wow. And 249, anti-Malarian hormone. We actually usually get higher levels than this, but it's unheard of to see it increase, and actually more follicles as well. And so here, as you can see, the a little more visually with the estradiol, I think is the key one there, and the anti-Malarian hormone. And then looking here, the Varian reserve, which is the key marker. Pregnancy onset. Oh yeah, so this is what you want to know is how many patients got pregnant, right? After they couldn't get pregnant with all this in vitro stuff. So after 4 to 6 months of treatment, 71% got pregnant. Then an additional 6 to 8 where they kept it going, 13% more. So 84% of these patients got pregnant who could not previous to giving the bioregulators, which is this, life-changing for these people. And you can see the increase anti-Malarian hormone and the follicles. And these are number of pregnancies. Again, that is addition, so 84%. And also things like here, these are again rat studies. So again, good for attorneys, we know, but having the cancer gene, the HER2, then giving them epitalon, the pineal peptide, basically a 73% reduction in the rate of cancer.
So Ken, we're getting to about almost, it's perfect timing. because we're getting to about an hour. So question, how long do people need to take these peptides normally to see results? Is this a short-term treatment? It's a long-term after you stop the peptides? How well? I think that's like an essential question a lot of people probably would want to
Yeah.
know. Why don't
Yeah.
we stop sharing just so you and I can, and by the way, so how people get in touch with you, by the way, it's on the slide here, right?
Yeah, and we have, if you want the peptide protocol for the rapid treatment of Sears, we do a lot of talks, and we're going to start a year-long training, which maybe I can recruit someone on that. But
But for people to get in touch with you, it would be holtorfmed.com,
yeah,
integratedpeptides.com. That's how people would get in touch with you.
yeah, exactly. You can tell I'm a terrible marketer. But did that stop sharing there?
Yeah, that's great. So how long do people normally need to take these to see the effects? And is it a short term, long term? How does this work exactly?
Yeah, and we find in general, like everyone's so different, and some people like are I'm resistant to so many things, and but sensitive people like hours or days, and they'll start seeing a difference, over weeks, almost always. I can never guarantee it, of course, and and people are that's what the studies show, but a person's not a study; they're a person, so it could fall certainly outside of that, but the rate is very high that they get better. My girlfriend's very good. She picks people off the street and just gives them stuff and they take it, or at the conferences especially. And hey, guy limping, and then they come back like, oh my, it's kind of amazing stuff. And we're kind of used to it now. But you're of course you're getting all these patients who are untreatable better. So and certainly your blessings go to you. And most people we expect them to respond, but it's certainly not always. Like we have a gut formula. Fixing the gut is a foundation, and it has BPC, TB4, it fixes the tight junctions. And we added acromantia, which is associated with health and a lot of stuff. They'll get in the gut healthy, and doing them together even increases that even more. But the success or response rate is very high.
So one thing I think that would be great, if you and maybe for the Healing Lyme Summit, you could put this together. It would be a 1 or 2 page summary of because a lot of my patients, for example, do have leaky gut, myself included. I've fixed it
That
and worked on it.
70% of the population does.
Yeah. So, I mean, if you have, for example, leaky gut, mast cell activation, food sensitivities, these are the peptides that we recommend for this period. For those who have, for example, low thyroid or, adrenal dysfunction, these are I think if you could put together a little kind of bonus section for people in a PDF, that would be great because I know that's something that I myself am going to want to see and probably share with my
Yeah,
patients.
and I get asked, I hate protocols. I'm just not a protocol guy, but I'm like, everyone, doctors love protocols, patients love protocols. So I'm giving in. I'm going to do protocols. Um, but and we can also give out the ebook, the peptide protocol for Sears, and it has a lot of that stuff in there. But I will do the protocols.
Good. I'm glad I'm pushing notes. I mean, for someone like myself who's listening to this going, wow, this is an area that I really need to, learn more. And that for some of my highly resistant patients, I have a very good success rate with what I do, the
Absolutely,
way I'm
yeah.
doing it. But that doesn't mean there's not always a certain fraction of my patients that I'm struggling to get better, whether it's with POTS dysautonomia, because, I'm thinking, oh, they still have mold or they haven't done enough limbic retraining, for the pot, whatever the reason, listening to you, it's kind of like, well, hold on, there may be other ways of working on the POTS and dysautonomia and working on the mast cell, working on the leaky gut, working on hormone dysregulations, cognitive issues, that, this is a whole area of medicine. I don't think even most functional medicine doctors honestly have,
No,
really,
they don't. I'm very surprised. But
yeah.
yeah, it's another tool in your toolbox.
Yeah. So, Ken, this has been absolutely fascinating.
Well, thank
Wonderful.
you. That makes me feel
No,
good.
really, I learned tremendous amount. In fact, we'll talk privately after this talk, actually, about some of the things I want to try myself and try for my
Great.
wife. Um, and,
Love
and
it.
again, I want to really thank you for taking the time for sharing this for the Healing Lyme Summit, because I think people are going to get just a huge amount of information and hope, honestly, for some people that, have been very resistant and wondering like, what else is out there for me that might be able to help at this point. And looking at these peptides and bioregulators looks like really it's an area that needs to be looked into.
Yeah, and these what these patients go through and how they're treated, and I'm still surprised when patients cry the first visit. We haven't done anything just because you believe them. They're treated so poorly. It's horrible.
Yeah. So again, I just want to thank everyone for joining us today. You've been listening to myself, Dr. Richard Horowitz. I'm co-host of the Doctors Talk Healing Lyme Summit 2.0, and we've been talking with Dr. Kent Holtorf, who himself has gone through the healing Lyme journey and come out the other side. In
It
fact, much
sucks.
better with peptide therapy. I mean, really some amazing healing stories today, Ken. I want to thank you so much for
Thank
joining
you.
us.
Thank you for what you do. Like it's just inspirational and it just keeps everyone going, I think. So and thank you for you're so generous with your time and your knowledge. So thank you. I've been following you. You didn't know I'm in the shadows, little people, but but no, thank you. You've just been a great role model and just an inspiration. So thank you.
No, thank you. And again, Ken, one more time for people that again want to get in touch with you again, give the website again, how they'll be able to get in touch with you.
Yeah, I'm not officially basically part of Integrative Peptides, integrativepeptides.com, holtorfmed.com, holtrfmed.com, and El Segundo. Then I would also check out the nonprofit National Academy of Hypothyroidism, nahypothyroidism.org. Some good papers on there about the way we treat and diagnose thyroid is wrong. So
Okay.
thank you.
Yeah, Ken, thank you so much. And again, for those of you who've been tuning in, I want to really thank you for your time today. Please check this out a little bit more in detail, as I will be doing for myself and my patients. And again, I want to thank everyone for tuning in today for this episode. We'll see you again for another episode soon. Thank you so much.
Thank you so much.